will be reporting regarding merscov, its modes of transmission, signs and symptoms, incubation period.
We're also going to discuss about the outbreak itself, what has been done internationally about it, and the role of the public health nurse towards this outbreak. We're going to also have a short class discussion and activity about the epitriad.
MERS virus. So what is it? We'll start by breaking down the name. ME stands for Middle East, as it did start in Saudi Arabia in 2012. RS stands for respiratory symptoms because it produces respiratory symptoms such as coughing, fever, shortness of breath, and in severe cases can also cause pneumonia. And lastly, it is caused by coronavirus. Coronavirus is from the family of common colds to severe acute respiratory syndrome. It is named corona, as its term in Latin as crown, based on the physical characteristics of the virus. What are its modes of transmission? Scientists believe that the original host come from bats, which is similar to that of the SARS virus. How it got transmitted to camels, however, is still uncertain up to date. So how do humans contract the virus? It is said to be through direct and indirect contact with the dromedary camels in ways such as ingestion of camel products or preparing raw meat, collecting their milk, coming in contact with their urine as well as their feces. And how does this virus get transmitted from one person to another is said to be through close contact, such as living in the same household of an individual that's sick with the virus, and in a hospital setting through shared room with an individual who's sick with the virus, and for workers to contract that is if we're not using the appropriate equipment. Our correspondent Ellie will tell us more regarding the merscov outbreak.
And good morning to our viewers. There has been an increase in the number of people with Middle East respiratory syndrome in Saudi Arabia. The most recent outbreak has 12 reported cases between the months of September 27 to October 31st, 2017. The biggest outbreak, however, took place outside of the Arabian Peninsula, that is in South Korea, where they have reported 184 confirmed cases from May 24th to July 15th of 2015.
Who are affected by the virus and who are at risk of acquiring the virus?
Yes, Jam. Actually, those who are greatly affected by this outbreak are those who travel in the Arabian Peninsula. As the virus is closely linked to camels, people working in herds, butcheries, farms, markets, and barns are at higher risk of contracting the virus. Furthermore, pregnant women, those who are elderly, and the young ones, to include those who are immunocompromised, are also at greater risks.
Seems like it's an ongoing issue. Tell me what's being done about it.
Yes, indeed, Jam. Unfortunately, at the moment, there isn't any cure yet. In fact, the Ministry of Health in Saudi Arabia and other health authorities, to include the World Health Organization, are gathering data for the scientists to know enough of the virus in order for them to develop a vaccine, which of course can take years of experimentation and studies in order for it to be viable. To date, the Ministry of Saudi Arabia has invited 4 vaccine companies to start on developing the vaccine that can help with this ongoing outbreak. For the time being, treatment focuses on symptom management such as oxygen support, prevention of complications like pneumonia and respiratory failure, empiric use of antibiotics, antifungals, and other related medications. People are encouraged to perform hand hygiene, avoid close contact with sick individuals, and to wear face masks when out in the public. They were also advised to avoid consumption of raw meat and meat products. The scientists are also advising people to avoid camel meat and milk. Healthcare professionals, on the other hand, are mandated to implement strict infection control when handling patients who are symptomatic. Okay, Jam. So, on an international level, how is the World Health Organization communication guidelines being implemented?
Okay, Ellie, the World Health Organization with the Saudi Arabia Ministry of Health, they do inform the public at the earliest time possible regarding information about merscov. This is to prevent the public from panicking, right, as well as misinformation regarding what's the real information about this virus, right? Other ways that this is being done is they do increased public awareness programs such as websites, blogs, brochures, videos regarding merscov, its ways of transmissions, and also its how to prevent it. Right. Another one is also creating guidelines for healthcare workers as to how to properly take care of individuals that are affected with the virus.
Yeah.
Another one is there's also continuous surveillance, which is being done locally and internationally through strict infection control and screening for possible patients that are displaying symptoms of merscov.
Okay, so what you're trying to do here as well, or trying to say here, is that public health nurses are also doing dissemination of information through travel advisories for those people who are traveling inside and out of the South Arabian Peninsula, should I say?
Yes, that's correct.
Okay, so that's good to know actually, because I'm a traveler myself, and I think it's a very big role for the health organization, especially the role of the public health nurses in doing this.
All right.
Thank you, Jan. Since the start of the outbreak, primary health nurses are doing their utmost best to be out in the field and attend to the needs of the public until this outbreak is well controlled. The following objectives were observed to ensure community needs are met. In addition to what we've discussed, primary health nurses also ensures professional relationship is maintained with members of the public. This is by means of establishing trust and rapport, and also to advocate major public concerns. This involves continuous community collaboration during monitoring of symptoms, symptom management, and outbreak prevention. Nurses wanted to ensure that equality is highly observed for every community member, regardless of their color and social status. This means that people have equal privileges and access to community resources such as the health centers. Furthermore, professional responsibility and accountability is highly maintained to safeguard public interest and certify competencies for each member of the team. Various trainings were provided regarding merscov outbreak, and nurses are expected to continuously update this. Primary health nurses provide some travel advisories over the radio and through the media for travelers and migrant workers of countries that are affected by the outbreak. As part of restoration and palliation campaign, nurses provided continuous updates related to the outbreak and performed community knowledge assessments regarding prevention, monitoring of symptoms, and managing those who are symptomatic due to coronavirus.
That's the end of our report for merscov.
Up next, a brief class activity on the epidemiology of merscov outbreak when VCC News returns. This is Ellie Gentarola
And Jamina Garcia.
reporting.